Cindy Young has currently served as a senior health policy advisor, worked for healthcare reform for 25 years. And she now serves, if I have this correctly, as the labor co-chair of the California Education Coalition for Health Reform, one of the strongest voices currently in the debate. We're lucky to have her here with us today.
Thank you. Thank you, and thanks everybody for having me here this afternoon. I've worked for California School Employees Association since 1988, and I want to describe the type of people that work that I represent. It's school bus drivers, food service workers, groundskeepers, school secretaries. So if you were to take teachers and management out of a school, classified school employees would be the folks that are left. They're kind of the people that really do the work to keep the school working. I started a career in health policy as the research director for HERE Local 2 in 1984. I've been working on healthcare reform for almost 30 years, and benefits at the bargaining table have, I've seen firsthand how this employer-based system is beginning to crumble. The system's failing really primarily from my perspective for three reasons. One is uncontrolled cost inflation. The next is that premiums and healthcare costs are increasingly unaffordable for employers and employees, and I'm going to cite you some examples later. And the levels of coverage that employees are being covered are continually, every year after each round of bargaining, the plan is worse. Our members are paying more out of pocket when they access the system. So you have them paying more out of their paycheck for premiums for their share of the cost, and then when they go to access the system, they go to the doctor's office or they go to pick up a prescription drug, they're paying more out of pocket. Healthcare benefits are a mandatory subject of bargaining under the National Labor Relations Act. When I first started bargaining health care benefits in 1984, it was common for employers for us to bargain health care coverage which provided for full family coverage. Generally, workers had a $1 copayment for physician visits and prescription drugs. In the hotel and restaurant business where I started, workers used to, and I represented restaurant and hotel workers, they used to work 3 3-hour shifts a week, and they got full family health care coverage when they worked that amount for their entire family. But by the early 90s, insurance premiums were rising far faster than the consumer price index. Unable to afford health care cost increases, employers began demanding that it cap its premium payment for health insurance. So that means that they would say if it costs $600 a month, that's it, that's all we're going to pay. If it goes up to $700 a year, you will be responsible for the additional amount. This meant, again, that our folks had to pay a part of the premium, and then again, more when they went to the doctor. And there's another phenomenon that's happening. While we used to have full family coverage, we're seeing now that people are having to pay more for their dependents. So if you want to cover your spouse, your partner, or your children, you end up having to pay more out of pocket for family coverage. Today, private health insurance costs continue to rise. They are increasing by 6.7% a year, while out-of-pocket payments grow by 6.1%, more than double the rise of the cost of living. And I don't think there's one state in the nation, but I'm certainly sure everyone has heard about the budget crisis that we're having in California. There is a zero COLA this year for us. So if we have 8% healthcare inflation, which is what is projected in our state, there's no wage increase, the employer caps its share of the contribution, think of what happens to classified school employees or any workers in my state. And I don't think that my state's unusual. I think that this phenomenon is happening all over the country. The insurance industry passes these increases on to employers who then just say, I can't deal with it anymore. If you want insurance, the burden belongs to you. The cost of health insurance premiums alone have far outstripped overall inflation and the growth of workers' earnings for most of the past 20 years, making health insurance progressively more unaffordable for Americans. The best example that I can illustrate, and actually when I started writing this on Sunday, I was talking to a labor relations representative at Los Angeles Unified School District, and I thought, well, this is a perfect example to talk to you all about today. Los Angeles Unified is the second largest school district in this country. And they just finished bargaining, and now everyone's like, oh gosh, what do we do? We're pulling out our hair. What's going to happen as a result of that is the employer capped its contribution rate. So last month, the unions at LA Unified just completed bargaining for health care benefits. The average cost to insure a family in 2009 is $12,000 a year. The Los Angeles Unified School District is spending $930 million a year for insurance benefits. That's for health, dental, and vision. When I first started working at LA Unified, I've worked on LA Unified for every year since 1992. It spent $330 million a year. So think about that. 1992, $330 million a year. 2009, $930 million a year. In 17 years, insurance premiums have almost tripled. Because health care is so expensive, the district can't insure 9,000 classified school employees that cook for our children, drive them to school on buses, and provide instructional assistance to students. For the very first time in history, Los Angeles Unified School District capped its contributions for health insurance and has agreed to pay only 3.54% of what is projected to be an 8% increase in health insurance premiums. On average, a classified school employee earns $30,000 a year. In 2007, classified school employees paid on average about $230 a month out of their paychecks for health insurance. This does not include the co-payments and deductibles that they had to pay for when they accessed the system. The impact of that on a worker who makes $40,000 a year will end up paying more proportionally of their paycheck or their take-home than a school district management employee. So in a sense, this is a regressive tax. If you earn $30,000 a year and you're paying $230 a month, it's very different than if you earn $100,000 a year and you're paying $230 a month out of your paycheck. Today, 85% of the CSEA collective bargaining agreements have an employer cap for health insurance, costs they can't afford. And I have to tell you, when you mentioned I serve as the labor co-chair of the California, as the Education Coalition for Healthcare Reform, the employer doesn't know what to do about this either. In a sense, in schools, we're a little bit fortunate because they're not in the business to make money. They're actually in the business to educate our children. So we're not dealing with nasty employers on the other side. They simply don't know what to do but to say, we have a constricted state budget. We have no money, right? We give you health care if we had it, but we can't. So 85% of our contracts have capped employer contributions. CSEA represents thousands of part-time employees who are paying hundreds of dollars a month for health insurance. And we're now beginning to identify workers who actually are beginning to write checks to the school district at the end of the month because their share of the insurance premium exceeds what their income is. So if you take a person that works 3 or 4 hours a day, and the employer has capped the contribution, and then they prorate it based on the number of hours that you work, right? We now have workers that we represent that are writing checks to school districts at the end of the month for their insurance premium. I think my last point is critical. Keeping the insurance you have is not going to help our membership. We are paying more and getting less in coverage. In 1984, when I worked at Local 2, again, if you worked the 3 shifts, you got full family coverage. Today, I represent 100,000 classified school employees in the state of California that do not qualify for employer-paid coverage because they don't work enough hours. I represent workers who on average earn about $30 a year. California school districts now pay approximately 16% of its budget on employee benefits, and I'll tell you that 4 years ago that was 12%. So you can see exponentially, and this is taxpayer dollars, right? Our benefits are funded from taxpayer dollars. The CSA Research Department is identifying more collective bargaining agreements that have $20 co-payments for physician visits and $30 co-payments for prescription drugs.